thyroid, so I'm pretty easygoing. If you have a question in the middle, just throw your hand up and we'll answer it. If you want to wait till questions at the end, we can do that as well. If I am talking too low, just put your hand up and tell me to go up. Yeah, okay. And a nasty habit is if I'm talking too fast, okay, because I can tend to motor right along. And if it's too fast, just give me a signal, and I'm certainly happy to slow down. I kind of lose track of that. Okay? All right. So again, I wanted to thank Norland for inviting me to come do this talk today. It's a wonderful opportunity to come into a space like this and talk to people who are interested and getting educated on specific things that they're interested in. We don't have a lot of those spaces, and it's wonderful to have that and have them offer that. So I really appreciate that. Today, we're going to be talking about thyroid. And thyroid can be quite confusing. It seems Wayne and I were actually talking, the more and more you dig into thyroid to learn about it, it seems like every road that you get to, there's 3 more roads to go off. And so it can get pretty convoluted. So my goal here today is just to try to give an overall view of what thyroid is, what it does, and kind of answer some basic questions and go from there. Okay? Oh, here we go. See, technology already. Here we go. All right, so goals of our discussion today, and I believe this is in your handout, to understand what the thyroid is and what it actually does, to understand how thyroid dysfunction is actually properly diagnosed. Today in the world of medicine, we still don't necessarily diagnose thyroid disease properly. Understanding the treatment of thyroid dysfunction. There are traditional treatments. There are compounded treatment options. There are nutritional therapy for the thyroid, more of a holistic, natural kind of approach. And so hopefully today when we're done, you're going to walk out with, 3 to 5 different ideas of, oh, I could do this to help with my situation. Whether that situation is you have a thyroid concern, or if you're here because a loved one has a thyroid concern, or like me, you just are a lifelong learner and you like to learn about things and you're here just to get information today. So this is your own personal quiz. You're not expected to answer this. There'll be no grading of this quiz, but just think about as we move forward, what is the thyroid function? Do you know what the function of the thyroid is? What lab tests do we use to diagnose thyroid disorders? What is the common treatment for thyroid disorder, particularly hypothyroid, but we'll talk about that. And what other gland or glands must be healthy in the body for the thyroid hormone to work properly? Okay, yeah, see, there's just always something else at the end of that road that moves into something else. So the thyroid, so this is what we're talking about. The thyroid is this butterfly gland that sits right here in the neck. It's right around the trachea and the larynx. You may have seen sometimes where there's like a swelling kind of area of that. If you have a physical, you may have a provider stand behind you and kind of feel that area. They're feeling for the size of that thyroid, the texture of that thyroid, if there's nodules in that thyroid. Okay? And so going through all of this, just to kind of back up a second, why thyroid is so important. Years ago, before we had like the invent of antibiotics, infection killed most people, and that kind of makes sense, right? Antibiotics were created that kind of took that out of the #1 spot. Today, what is the #1 killer of particularly Americans is heart disease, cancer, unintentional injuries, stroke, and chronic respiratory diseases, okay? So heart disease right on the top of that list. And so thyroid is very closely connected with thyroid function. If your thyroid function is too low, then you can have elevated cholesterol levels. That will increase your plaque burden, so to speak, if you've heard about atherosclerosis and how plaque gets into the arteries and causes blockages, okay? If that thyroid level isn't functioning properly, it can contribute to that. And so that can contribute to heart disease. So, your cholesterol level might have something to do with your thyroid level. So that's just interesting how everything is interconnected, and it really is. Needing to get to the root cause of what's happening with something to be able to figure out how to move forward with that's important. So it may be a heart issue, but it could directly be related to your thyroid. So the thyroid itself regulates metabolism in the body. It releases hormones for energy production, and it really just affects every organ and every system in your body. Let me see if it's the next one. No, I think we're going to stay there. So TSH, the other quiz question is, what is the blood test that we diagnose thyroid? That is a TSH. It's a thyroid stimulating hormone. So you go in, you get blood work drawn, and you get a number. That number is called your TSH. That is one number in your thyroid panel. Sometimes we just look at that one number. And if you are within that normal range, we say everything is okay. It doesn't necessarily matter what your symptoms are. You may say, well, my thyroid number, my TSH number is normal, but why do I feel like the way I do? And so you need to dig deeper, right? You need to dig closer to the root of what's causing it. And that thyroid number in itself, that TSH, isn't always just enough. So metabolism, growth, cardiovascular, central nervous, reproductive. That's everything that the thyroid will affect. Sorry, I do tend to bounce around and I apologize, yes. Yes, and we're going to talk about that pretty in depth. But yes, that TSH is that first number, and oftentimes they will run just that number, and they might reflex it, meaning that if there's something in that panel that's out of the normal, they will then like add a T4, which we'll talk about what a T4 is. But typically, it doesn't reflect to everything in the panel. You have to specifically order everything in the panel, a T3, a T4, a TPO, to be able to get a big picture of what's going on with your thyroid. Yep. So hopefully when we get done talking today, you'll have some more information to have a conversation with your provider, right? To say, hey, what do you think about this? Or this is what I think I would like to have and why. So symptoms of hypothyroid. So hypothyroid means your thyroid is not functioning properly. It's not producing the hormones it needs to produce. It's a little confusing. It's called hypothyroid, but your TSH level will be high. Okay, so things that you may feel. You may feel that glandular enlargement. You may feel like something's in my throat, or when I swallow, that feels different, like something's in there. People will come in and say, I just feel there's a tightness in my throat. Decreased heart rate, low blood pressure. You may have more fluid retention, like in your hands. You may feel like you have swelling in your hands or in your feet a little more. Weight gain, all right, or the inability to lose weight if you're trying to lose weight. Your feet and hands may typically be a little colder than what you would think they should be. You're a little bit more intolerant to the cold. You might have some constipation. You might actually have throat pain or hoarseness in your voice, difficulty swallowing. There's that elevated cholesterol, and then just generalized fatigue without any really known reason. Why do I feel so fatigued? Why do I feel so tired? Some other symptoms that people feel when their thyroid is not functioning properly and they have what's diagnosed as hypothyroid. Overall, they may notice that their skin is much drier. They may have hair loss or hair thinning. Their nails may be more brittle than what they had been before or when they compare it to other people. Sometimes eyelids will feel a little swollen or look a little swollen. Our eyes are puffy. Infertility, menstrual issues in women, depression. You can see depression, inability to concentrate. If you've heard the term brain fog, when people feel like they just aren't on top of things or not quite as sharp as what they feel like they should be. Maybe they forget things in mid-sentence, things like that. Nervousness, muscle pain, muscle weakness, muscle cramping, and irritability. Those can all be signs of a low thyroid. Now, hyperthyroid is the opposite spectrum. So with thyroid, there's two main functions, really, that dysfunctions that we look at. hypo and hyperthyroid. Our talk today is mostly going to be about hypothyroid, but the flip side, the other side of the coin to that is hyperthyroid, and that's when your TSH number is very, very low, and you will feel if it's an overly active thyroid, you're going to feel increased heart rate, anxiety, weight loss, okay? So there's more going on there, and that would be for another talk, but you can have the opposite of low thyroid, and you can have high thyroid. So for low thyroid, the prevalence most is greater in women. Men do have low thyroids, but we do see it more in women. And as we age, we see a little bit of a higher opportunity for people to develop hypothyroidism as they age. There is a lot of subclinical hypothyroidism, and they do estimate that to be about 40% of the population. So what does that mean? That means that your thyroid level might kind of be in the normal range, but you're not feeling it. You're not feeling like you should. You're not having the energy. You're not having all the effects of a properly functioning thyroid, but the number is still within the normal range of thyroid. And then they anticipate about 1% of people have hyperthyroidism. So when you talk about how the thyroid works, the thyroid has two main hormones. And I probably will bounce around, and I apologize, but I'll try to kind of frame it for you. You have the glands in the brain. One of those is the hypothalamus, and it produces a hormone, and it sends that hormone down to your pituitary gland. And that's their neighbors up there. The pituitary gland, when it notices that there's not enough T4 or T3 floating around in your body, it says, hey, I need more TSH, thyroid stimulating hormone, to produce. So thyroid stimulating, the pituitary sends a hormone down to the thyroid to say, stimulate more hormones. I need more hormones to work because it's low in the system. Those hormones that the thyroid creates are T3 and T4. Those are the chemical names, and that's why we call them T3 and T4, because we don't want to have to say those names all the time.
I have a question.
Yep.
I just got a test of my T4 and TSA. Do I request a T3?
It's going to depend on what your numbers are and what's going on. Yep. Yep. It's not always the full picture. It depends on those specific numbers. Yep. So when you look at what's the difference between T3 and T4, so now the brain has released chemicals, told the thyroid, hey, we need more, we need more. The thyroid says, okay, I have T3 and T4 that I can put out into the bloodstream to kind of help get those numbers back up. So my person is doing well, okay? So T4, 80% of what is released is T4. It is less potent than T3, okay? So it's not going to be as strong as T3. And T4 is actually converted to T3 at a cellular level, okay? T3 is also produced by the thyroid, but only about 20% of that production is T3. And it is 10 to 15 times stronger, more potent than T4. And T3 is the actual active thyroid hormone. So T4, I always think of T4 as more like the storage, right? It produces it and you have it, but it's when it gets out into the body that it gets converted to T3, and then T3 is what actually goes into the cell, okay, to kind of help with your symptoms. So this is a bigger picture of that, right? The hypothalamus, that's in the brain, it releases this TRH, which then tells the pituitary gland, send me more thyroid stimulating hormone. We don't have enough in the blood. The thyroid then produces T4 and T3, which goes out into the bloodstream. T3 or 4 gets converted to T3, and then it gets into the cells where it actually will do some work. So the TRH, that's what's coming out of the hypothalamus. This is a slide that's just kind of telling you that. Stimulates the TSH. With TSH, the thyroid gland uses a little bit of iodine to help create that T3 and T4. And we have iodine in our diet in the United States, unless you're specifically looking, to not do that. Sometimes you might need a little bit of an iodine replacement if you're having a thyroid issue. You'll see that when we talk about the conversion, if there's not enough iodine, it won't convert properly. But we have iodine in our salt and different things. So typically we are going to have iodine in our system, but sometimes you need a little bit of supplementation with that. The T4, again, made in the thyroid gland. T3 is formed when we break down or convert, T3 is when we convert that T4 throughout the body. Those enzymes float around in the body, they get connected to proteins, and then those unbound protein or unbound thyroid hormones are what actually connects on to thyroid receptors and is able to get into the cell of our body cells to work on our systems. Again, T3 is more potent than T4. So what does this mean, right? That's just all the chemical stuff of how that works. So what that means is you get a lab test, you get your thyroid test done, you get your TSH level done. Your TSH level will be elevated, so greater than 4.7 is what the traditional numbers are right now. And that would tell you that you have hypothyroidism. The number's high, but your thyroid level is low. I'm not sure who designed that system, but they did. Your free T4 levels will be low. And that would be looking at that. So if your thyroid is high, your TSH is high, and your T4 is a little low, that's when I would, to your question, delve in a little deeper. What's going on? What's happening? But that would be an official lab diagnosis. The goal is to keep that TSH in a normal range. Now, we're going to talk about what normal range means. So 0.5 to 4.7 is what's considered a normal range. There are some problems with that comment, normal range. Every person is individualized, and so what might be a normal number for you, and you may feel well at that number, may not be a normal number for me, and I may not feel well at that number. So it's really about individualizing what's best for you. You want to be in an optimal curve, which is that centerpiece, right? You don't want to be really low, you don't want to be really high, you want to be in what's optimal for you. So when we just get a TSH level, why is there a problem? Sometimes with just looking at, oh, I had a TSH, my provider told me, your number's good, you should feel fine. And you're not feeling fine, you're not in that optimal range for you. So the range is too wide. So again, some people can feel well at a low number, and other people feel miserable at a low number. Some people can feel good at a high number, other people will feel miserable at a high number. So that range is too high. Signs and symptoms must be accounted for, so you have to make sure all the signs and symptoms that you're experiencing, fatigue, low energy, is that related to your thyroid, or is there something else going on? It does only look at an indirect indicator. It's looking at that TSH that the pituitary gland is excreting. It's not actually looking at the T3 and T4, which are actual hormones that are helping get into the cell tissues. So it's kind of indirectly giving you some information. Any questions right now on any of that? I know that's just a lot of numbers. Mm-hmm.
Did you say the normal range should be 0.5 to 0.7?
The normal range, we'll flip back here. What they're considering the normal range is 0.5 to 4.7. Yeah, so that's pretty wide. But actually, when you look functionally, like the National Academy of Clinical Biochemistry, they actually state that you should have a much narrower range, right? And they believe that you will feel better if your TSH level is below 2.5. So more in the range of 0.5 to 2.5 is where most people are going to feel their best.
I have a question on that. Mm-hmm. Does it go according to the lab you go to? Because I have one here, different figure.
Yes. So when you look across the country at how labs are drawn, they look at the region that you're in, and then they take the averages of everybody in that region. Now, That's probably in the last 10, 15 years. Maybe they've tightened up a little bit on that. Prior to standardizing some tests, it really could be different. If you got your lab test in California, you could have a different TSH level than your lab, same specimen that you had processed in Maine, different than what it was in Florida. But they recognize that. So there are some standardizations now. They do standardize glucose, right? That is a standard across the board. And they are standardizing TSHs as well, but it's still a wide range. The labs aren't saying we think our normal range is less than 2.5. It'll still tell you that most of them have a range somewhere at about 0.5 to 4.7. Might be slightly different, but it's going to be a larger range. They have not narrowed that range down. Usually through functional medicines, they do that, more likely have a narrower range. You don't, and we'll talk about that. So you do have to look at some of the other issues that are going on. There's rarely any time that you can say it's one specific thing without ruling out other things. Yes. If you're not feeling well between the 0.5 and the 4.7, well then you're the lower range, well then we have to figure out why. Is it a conversion issue? Is it a pituitary gland issue? Okay. So there are some more holistic approaches. You can do medicines, and we'll be talking about all that. There is a book here, What Your Doctor May Not Tell You About. You could always look through that. That'll give you a little bit more in-depth information about thyroid testing. We look at your medical history, physical exam, try to figure out more of what's going on with you. So do you have low thyroid? So TSH, again, 0.5 to 2.0 is what we would kind of want to narrow that down and say that's more of a normal optimal range versus a wider range. Your free T4 is going to be, the normal is going to be 8 to 180 and the free T3, 55 to 120. So when we start seeing things that are not in those ranges, it starts giving us a pathway to what's going on. We just kind of touched on this through medical history, your physical exam, what symptoms are you having, fatigue, cold extremities, weight loss, hair thinning, loss of hair. Do you have family history of thyroid issues? Is your thyroid gland enlarged? You will hear this often, the outer third of someone's eyebrows start to not grow in as much, and that's often an indicator of a thyroid issue. So you can do your basal body temperature, and you can check for that. That's checking your temperature first thing in the morning. It's going to basically be looking at your metabolism. If the thyroid's working well, your metabolism able to produce heat is going to be within a normal range. And this tells you here you can put a thermometer underneath your arm for about 10 minutes, record that temperature for 5 days in a row, and the normal is going to be 97.8 to 98.2. Too low, too high, that gives us another piece of information to put into the puzzle. So what causes hypothyroidism? So you have a primary, what we believe is that there's a primary and a secondary cause for why your thyroid is not working properly. One of the primary reasons is autoimmune disease. So Hashimoto's, you'll hear people talk about Hashimoto's thyroid. And that means that there is an autoimmune component to why your thyroid level is low. If you've had radiation to your thyroid, that can cause that. If you have iodine deficiency, you can have low thyroid. We touched on iodine deficiency. We don't see that a lot, right? Because we live in a country where we have iodine in our food and in our supplements, but it can happen. With Hashimoto's being autoimmune, when you ask a couple questions where, well, what do we do if our numbers are off? How do we know? Well, one thing you can do is extend your thyroid panel and get a TPO. That's part of that test. A TPO portion of the test tells you if your body is producing antibodies that are geared towards your thyroid. So autoimmune diseases are when the body does not recognize their own body itself as part of itself. It thinks it's a foreign invader. It thinks it's not supposed to be there. So the body starts to produce antibodies to ward that off. Just like if you have a cold, you get a virus, right? Your body says, I don't know what that is. It creates antibodies to try to fight off that virus. Unfortunately, with autoimmune disease, that's the kind of the foundation with that as well. Something comes into the body or is happening in the body, and the body doesn't recognize it as itself, so it starts to develop antibodies to get rid of that. With Hashimoto's specifically, it's the thyroid. So when hypothyroidism with Hashimoto's happens, the body doesn't recognize the thyroid as part of itself, so it starts developing antibodies that will actually kill the thyroid. And we see that with TPO. That is the antibody number. When we draw that blood work, we see, do you have antibodies against your thyroid in your blood? You shouldn't have any. Now, there are numbers, 30 and above. Somebody's going to officially say, oh, this is Hashimoto's. But I would postulate you shouldn't have any. There should be no antibodies that your body is producing against your thyroid to try to harm it. If there is, that's the beginning. Something's happening. Your body's recognizing it. We're just not registering it until we get 30 or higher. Mm-hmm. Mm-hmm. Well, part of it would be, yeah. I think part of that. It depends. It depends. So autoimmune, for sure, there's some triggers that can cause that. And if you have a very low lying, and you can find those triggers and you can offset those triggers, yes, I think I have seen TPOs go into remission where you don't have any. Sometimes you will end up just having a very low TPO, but what you've done is you've stopped the progression of TPO. You've stopped the progression of the antibodies being produced, and you've stopped the damage to the thyroid. So it's when we don't recognize it that years and years and years go by, and our TPOs, our antibodies, keep damaging the thyroid, that it gets to the point it can't recover. So we give you medicine, and medicine takes the place of that, of the thyroid. So the thyroid's producing hormones, but if it's dying, it's not going to produce those hormones because it's dying because TPO is killing it. Does that make sense? Yeah, so yeah, and so there's definitely different there's definitely different theories. There's still a lot of research that has to be done. I mean, again, we still have a very large range of what we consider normal for TSH. And, you know, if you go into a primary care doctor, they may say, hey, your thyroid is 3.5. It's fine. You don't need anything. But you know, it's not. You don't feel right. Something's not right. And when you look deeper and you look into your numbers and you say, okay, well, my TSH is high and my T4 is off, and now I got this TPO, and my TPO is 200. You have autoimmune thyroid, because you shouldn't have TPOs. You shouldn't have antibodies in the body that are killing your thyroid. But there is some belief that you can't change that. And so you allow the process to go through, kill the thyroid, and we will replace your thyroid hormones with synthetic hormones. And you will just be on medicine to replace that. There are other theories that you can stop the triggers of what's causing the body to create those antibodies, and you can slow or stop that process. And so if you would look at this book, Hashimoto Protocol by Isabella Wentz, she has a lot in that book, very knowledgeable, the root cause. Again, not just looking at the Band-Aid piece to put on this, but underneath what's happening. You have hypothyroidism, so we're going to give you medicine. But the root cause is you have an autoimmune. We need to fix the autoimmune, because if you fix the root, the rest of it will improve some. So with autoimmune, in her book, she focuses a lot on that. So removing gluten from your diet, possibly removing dairy from your diet, looking at the gut health, the microbiome in your gut, because there is such a connection between your gut and your brain, your gut and your thyroid. And if your gut isn't healthy, and that would be a whole nother conversation about how we affect the microbiome in our gut. If that's not healthy, if it doesn't have what it needs in there to protect our immune system, because a lot of people believe that the immune system starts at the gut level. And if we don't have what we need in there, then it's not going to be able to help. One of the things with T3, a lot of the conversion and the work of T3 going from T4 to T3 happens in a healthy gut. You can have all the T3 that you want, or T4 that you want, but if you can't turn it into T3, which is the lock and the key. The T3 is the key. It's going to go in the lock, but if it can't turn it to get into the cell, if it wants to knock, 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 knock on the door all day long, but the cell door won't open to let it in, it can't get inside where it needs to work, do its work. So you have to be able to have a healthy gut to get that T3 converted so that it can get into the cells and help with the symptoms. So that's the primary reasons why people have low thyroid. Some other secondary reasons, I think she left in the back, but she'd ask about the pituitary. You can have a pituitary failure. If that pituitary gland isn't working, it's not going to produce TSH, the thyroid stimulating hormone that tells the thyroid, hey, there's not enough T3 and T4 floating around, make more. But if that pituitary gland can't tell the thyroid that because the pituitary gland isn't working, then the downstream effect is you can't get your T4 and T3 made from the thyroid because the pituitary is not telling it that. If you look at that one picture again, if you visualize that, oh, I can probably do it from here. I know it's might seem a little convoluted, but if you look at it that way, right? This is where your TSH is, right here, that pituitary. When you have low T3 and T4 in your bloodstream, that pituitary, well, actually the hypothalamus up there in the brain, recognizes that. It sends that TRH to the pituitary and says, hey, we need more thyroid hormones in the blood. How do we do that? The pituitary gland produces TSH. TSH goes to the thyroid, says, hey, we need more T3, T4, and the thyroid makes it. But if that pituitary gland isn't working, it can't send TSH. Remember, we also talked about why is TSH maybe not like the end-all, be-all test? Because we're measuring the TSH, but what we really want to know is, do we have T3 and T4? And do we have enough T3 to get into our cells? So that TSH just tells us that. It doesn't really tell us the bottom root numbers. I'm sorry, just one minute. Ma'am, you had a question?
I did. How do you know if you have a healthy gut?
So if you're eating fermented foods, kimchi, sauerkraut, probiotics, prebiotics, there's a good chance you have a healthy gut. If you're not having a lot of digestive issues, you could very well have a healthy gut. There are some tests that you can do. There are some stool testing things that you can do that will actually tell you what your microbiome has in there, and do you have enough of everything you need? Too much? Not enough? Is it balanced correctly? Yep, ma'am. Most likely not, because the pituitary is producing that TSH. Most likely, we would have to start looking at, is it converting it properly? We've got plenty of TSH out there floating around. I got it. And it's now having to tell the thyroid, make T4, make T3. But think about if you have autoimmune disease, and for years and years, you didn't know that you had antibodies being created killing your thyroid. You didn't know that. That thyroid tissue eventually won't be able to create T3 and T4, right? Because it's dying. So as those TPO numbers go up, that's why you should have that checked sooner versus later, so you can start making changes to stop that TPO production or bring it down, so that what thyroid you have is going to work well for you. I mean, people have thyroid cancer and they have to have their thyroid taken out. They have to be on thyroid medicine, period. End of story. You can't create thyroid T3, T4 without a thyroid. But for people who do have a thyroid, you certainly don't want that thyroid to die over a number of years just because we don't know anything else to do. And we're just going to let it die, and then we'll support you through that. there are other steps there that we can do ahead of time. Yes. TPO. T as in like Tom. Yep, TPO. Yep. If you just say, hey, I want a TPO in my thyroid test because I want to know about antibodies, any provider should know TPO. Yeah, you're welcome, ma'am.
Polyps. How does the thyroid get the polyps?
Nodules. So you will get nodules oftentimes just because of the way the tissue is in there. Nodules, yeah. We worry a little bit more about cancer, so abnormal cell development. Sometimes you can have nodules and that's not a problem, but sometimes that can be a sign of cancer. So, when you start developing nodules, sometimes you can feel them, or again, people will say my voice has changed, the texture, the characteristic of my voice, it's more hoarse, it's more harsh, I have difficulty swallowing, I feel like there's something in there. That's when, you get a physical exam, but typically you'll have an ultrasound done, and that will identify nodules. And then from there, if there's questions about that, then they sometimes will have you do some like biopsy testing to be able to tell, is this just a benign nodule of abnormal growth, or is there something else going on?
So do glands produce that?
I don't think so. I'm not 100% sure. I don't know if I could actually answer that today. But I'm not sure that actually is going to be the exact direct mechanism for your nodules. Did I miss anybody? Yeah.
What's the test?
That would be more of a hormonal test, I think. So I wouldn't normally order that with this. That would be something you would be referred or might have to have more hormonal testing. Wayne, do you know of anything with the pituitary?
So from the blood, not 100% sure, but they can take a picture of your pituitary, see if there's anything going on.
Yeah, I was going to say, I think maybe some hormone testing. Again, I think that would probably be not a direct measurement of your pituitary. It would be more lines of this is up or down. Oh, that might be related to your pituitary. And then that becomes separate than this, right? Then it's, you have to, again, get to the root cause. Why are you hypothyroid? Well, it's my pituitary. Well, now we have to go down that pathway and try to figure out what's going on with that pituitary. Can that be fixed, changed, whatever, to get this hypothyroid back in place?
Is that an endocrinologist?
Yes. Yeah.
Antidiuretic hormone.
Mm-hmm.
Yeah. And it's not as common, and you certainly. Yeah.
No, it's these most of the time. If we go back here, if we look at our primaries again, most of the time, Hashimoto's is going to be one of your number one. And then 2 is going to be that poor conversion from T4 to T3, which is a gut issue. Okay. And then, if your hormone it's looking at the big picture and then pulling in those strings that are common, looking at some of these lab tests and even a little bit deeper to be able to kind of come to a consensus of, well, this is most likely what's going on, and then working through how can we correct the root cause of that, right? Do you have TPOs? You have TPOs, you have autoimmune thyroid. And if you have autoimmune thyroid, any autoimmune disease, the research shows you have about a 25% chance of developing a second arthritis or psoriasis, something like that. I have patients come to me who say, you know, I have rheumatoid arthritis. We need to look at that thyroid because that they're going to be at a higher risk of having.
The desiccated thyroid, I'm the endocrinologist. But when I
Yeah. When I had to talk to endocrinology, the reasons that I usually get from them is they don't feel like it's a standardized. They don't know. They'll say, I can't tell you exactly what's in it, so I can't do anything about it. Yeah. Versus whereas if I do a synthetic and I can say there's actually this amount and this amount, so I think that's why.
50%
Yeah. It depends, but I have many women who have come to me and said, you know, I don't really want to do anything synthetic. I don't have to, and we'll use Armor or we'll use thyroid. Maybe their numbers be fine, and they feel fine. Yeah. I think it's a lot like diet sometimes too. Right? When I eat kimchi, I don't know how much probiotic is in that, but if I get a live, high quality probiotic that they can tell me there's 10 billion colonies in there, I know when I take that pill, that's what I'm getting. I think that's in part where that's at. They don't know exactly, and I mean, we could talk again as to maybe, you know, why, you know, some choices are made. Pharmacology. There's a lot of guidelines. I mean, you know, we have insurance that pays for a lot of stuff, and yeah, and it drives a lot of what providers do and don't do because you have to follow a guideline, and if you don't follow a guideline and something doesn't turn out with the expected, you know, what you expect to happen, then they can always look back at that and say, well, you didn't use something in the guideline. We don't have designated thyroid in the guideline. Our guideline says you should have used it. You didn't have the outcome you wanted. You didn't follow the rules.
You mentioned about the cold hands and feet. Well, my heart rate was in the 40s, and I ended up with a pacemaker in my heart because they were afraid I was going to have a stroke. But they never asked me about my hands and feet, but that was one of my main symptoms that I needed it because it was in June, and it was like I couldn't get warm. And my hands and feet were very pale, too. And after I got my pacemaker, they're pink. So,
yeah. So again, there's never just, you can't just say one symptom is related to one thing. You always have to look at the big picture. Because for you, your heart wasn't beating fast enough to supply cardiac output, so you weren't getting enough blood flow to your hands. So that makes sense. They were colder, the color was changing, right? So again, you have to kind of look at the big picture. You don't want to just automatically say, oh, it's my thyroid, and miss that my heart rate's too low to provide circulation. So when we talk about medication, some of the side effects, and you guys have this, I think, written in your handouts, but like any kind of medication, you can have side effects. When we do research and we do testing on medicines, you know, anybody in the group that's being tested, they have a side effect that gets listed. We can't always tell if it's a side effect of the medicine or just something going on. So that's why sometimes you see such large lists of side effects. But these are some of the side effects of our medications for thyroid: cardiovascular, increased heart rate, arrhythmia, which is an irregular heart beating. You have a heart attack. Tremors, headaches, insomnia, irritability, hyperactivity, nausea, vomiting, diarrhea, cramps, weight loss, fatigue. excessive sweating, muscle weakness, fever, hair loss. Nobody wants any of that, and you want to determine why are you having that? Is it this medicine or is it something else? So Synthroid, levothyroxine, that is the standard of care. That is the medicine that most likely your doctor is going to want to recommend you go on if you have low thyroid. Talk a little bit what is standard of care. Right? That's what has been researched. This is what you should do. It only has T4. It will bring your TSH into range, but what we talked about earlier is it's not just the TSH, right? TSH can be within a normal, what they consider a normal range, and you still not feel well. Your T3. 50% of people who take levothyroxine are not satisfied with how they feel. They're taking the medicine, but they don't really feel any big difference in their symptoms. It does have some other additives in it, such as like cornstarch, dyes, lactose. So if you're somebody who's lactose intolerant, or you have allergies, you can run into symptoms related to that. Armor thyroid, which is the desiccated, there's how much T3 and T4. Contains calcitonin, selenium. We start talking about medications, and we'll talk about that here, I think, again, but treatment for hypo T4 is not the only hormone, right? You have to have the T3. It's essential for many of the optimal health, and then you need that active T3 to actually get into the cells. So achieving the hypothyroidism balance, it's lifelong, right? You have to listen to your symptoms, your body, see how you're feeling. Because the thyroid, if you have thyroid tissue, it's going to make more and less based on what's going on. So when we talk about medications, right, like Synthroid, that is a standard medication that's made, and it's made and packaged and sent out for the standard patient. Not everyone is a standard person, right? I would rather say that most everybody is not a standard person. So you don't really know necessarily how that's going to affect you and if it's going to really truly help with all of your symptoms. So compounding, right? So compounding is what I think has always been done prior to big pharmacies taking over. Compounding was what your local apothecary did when you walked into the door and you talked about what your symptoms were. They picked and chose different things that were going to work with you and the volumes and the amounts they thought you needed, and they compiled a medication. We still do that. Norland does that. So it's more individualized for the client, what we think you need. And your provider can provide prescriptions for that. So for thyroid, probably would know more about this, but thyroid USP, similar makeup of Armor, but it doesn't have the cornstarch in it. So if you have somebody who has a sensitivity to that or that's bothersome to them in some way, it does has the same fixed ratio.
Yeah, I think that's the big point. It's more in biological ratio what we would see in our body, and so and that's what we can compound with. We can compound with the raw ingredients, but we'd also compound with this. Now, as thyroid goes, sometimes they go in and out. But right now, the FDA is kind of saying they don't like this, but that's happened in years past, and usually they change their mind.
Yeah. So when you talk about like biologic formulas, you're like, well, why would I want to do that versus something else? Well, when you are using more of the bioidentical hormones, it is structured more like what your body's structure is. And so your body recognizes that and can use it that way instead of having a different kind of structure through like a synthetic and not.
Your doctor prescription
Yeah.
compounding.
Yeah.
Prescription.
Yeah, and I'll be honest. I mean, that's not something that's taught to physicians or providers when they go to school. They talk to their pharmacist. They call Wayne and they say, hey, this is what I think I need. What, and then you kind of work out what you think you need, and you come up with a prescription. Yeah, and other providers that do what I do. Yeah. So there's lots of different things. Again, when you talk about compounding, even beyond this, the scope of this conversation, you can compound almost anything. I think you can do creams, you can do pills, you can do suspensions, you can do suppositories, you can do a lot of things to kind of individualize what it's needed for the client.
So it's saying that active ingredient is made up of a lot of that tablet has a lot of inactive ingredients too. And so sometimes the inactive ingredients, your body can respond adversely to those things too. So again, I think the point is that there's other things in there. That's if you're getting a 60 milligram of an Armour thyroid tablet or something like that. So that's a good clarifying question.
Yeah, so if somebody's having some type of adverse symptom, is it related to one of the inactive ingredients? And sometimes people know, right? We're learning more and more. People say, people every day say, I have number 4 dye, red dye. That's what I'm allergic to, because they've had testing and they've had things done. But a lot of people don't know that, or they don't know why they have GI upset. They never make the connection between X, Y, and Z. And so when you get it compounded, you have a lot less of that, because you have a lot less of the other inactive stuff. So other treatment options. What might be causing symptoms when the labs are normal? So we kind of talked about this a little bit. Again, it can be not necessarily that it's the pituitary, right? If the pituitary is doing its thing, it's having TSH, it's out there, but maybe you have a poor conversion from T4 to T3. And we talked about the gut, right? The importance of how that gut helps that happen. The receptor sites, the resistance to T3. So, right, T3 comes knocking at the cell door, knock, 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 let me in. And if that door isn't opening, there's some resistance to that happening. That can cause people to not feel the way they think they should feel, although their numbers are normal. We talked a little bit about how the adrenal gland and the cortisol production, the stress hormone, how that can affect and keep everything out of balance. And then foundational nutritional don't have the vitamins and minerals that your body needs, it can't do what it needs to do. So you have to have, a good diet, or you have to supplement with good, high quality vitamins and minerals so that your body has the building blocks it needs to keep. So what can you do before taking a thyroid medication, or if you think your thyroid medication is not working? So again, I did mention there are going to be critical times that, you're going to go in and your number is going to be so critical that no matter what, your provider may say you need to be on thyroid medication right now, because you can go into coma if you have too high of a thyroid and it's not addressed. So I don't want you to walk away thinking, oh, I would never have to do any of that. You might, but then you might be able to get stabilized and then slowly come off of that medicine or reduce